morning, Dan. What were you doing this morning?
COVID numbers, and appointment availability.
COVID numbers?
Yeah,
COVID numbers from the task force, or from the county, or?
from the county.
Yeah, I just did COVID numbers from the county, everyone his remarks, and I just threw in the task force stuff from Friday, just 'cause I thought that they were relatively telling on Friday, because it was pretty high.
Yeah.
With the Omicron variant being found on Friday, I thought it was,
Very
I mean,
timely.
bringing all those numbers that are coming in from them, those are Omicron, those are Delta. Yeah. So our appointments crowded?
Johnson & Johnson and Pfizer have a lot of open.
Just around the various pharmacies and stuff, or
Yeah,
just, okay.
and then, Moderna, especially for just the health department, didn't have any available until the January sixth, I think.
So what's in the journal?
I don't know.
That's weird.
I have no idea.
Interesting.
Yeah,
That'd be a good question to ask him. Might need it, might check right there. Is it good?
Good.
It's Chris. Hey, good morning. I'm about to move a news conference here. Can I call you right back? If I lost Rackus? Oh my God, those are my Rackus here. Okay. Yeah, blackhead bag? Yep, oh my God, I'll be back later this morning. Thank you so much, Marie. Bye-bye. Somebody was snooping on the jet. That was no bueno.
Hello. Hey, Jason. Doing good. Monday, thought I'd just stop by here. A lot of trouble.
Were you doing the numbers off of Moore's,
No,
off of
no,
the
no.
remarks for pages?
What?
Yeah, the 255 days a day. and
Yeah.
The vaccination rate and everything.
Yes.
I think
But
what was
St.
it, 255 a
Louis-
day and up
not
9.5%
St.
from the week
Louis
before,
Yeah.
is that right? Okay.
I mean, that seems to be what most of the.
I just mentioned the vaccination rates, I had time to fill
Yeah, but there's
Yeah.
much more conflict for St. Louis County.
the
than
fully vaccinated and single
Oh,
dose
yeah.
vaccinations in the county.
But the process in the county is just so screwed up.
Yeah. Structurally, it just seems like you'll never read anywhere.
No, it's just silly. The idea of having.
So like,
The idea of it being like 5 Republicans, 5 Democrats, one constitution, one green, actually, is a pretty good idea. But it don't
Yeah.
happen. But it would give, that would give a lot of, that would give a huge amount of power to their party.
So, my friend.
They could decide now.
Yeah. But you,
you know, is that information still current? I'm not sure. Have fun. I figured it was real accessible. Because that's how you are. I wake up in the morning, the first thing I see is Doug Moore, remarks for tomorrow.
Good morning. Thanks for joining me. Our sign language interpreter was not able to join us this morning, so I apologize for that inconvenience. Like you, I've been closely following the latest information on the Omicron variant, which is now in the St. Louis region. With the first Missouri case reported in St. Louis City on Friday, we know that other cases of the variant will be confirmed in the region in the coming days. We just don't know the extent of the variant's reach or the impact it's going to have on our community. We do know it's quickly spreading across the world, and our best path forward is to continue the practices that can keep us all safe. That includes vaccines and masks. As a new variant arrives here, our Department of Public Health is collaborating with the Missouri Department of Health and Senior Services and the City Health Department to support any cross-jurisdictional case investigation and contact tracing needs. We're closely monitoring the situation. We know there's a lot of anxiety around this latest chapter of the virus, and we will continue providing regular updates as more information becomes available. The Omicron variant is unique because of the large number of mutations that it has compared to the other variants. The scientific community is still working hard to answer key questions like, how will all the vaccines respond to the new variant? We do know that vaccines have been effective with the other variants, and that is the expectation with this variant as well. Is Omicron more contagious than Delta? It's too early to know, but we know the new variant has been reported in at least 15 states, and that number is expected to jump within the next few days, especially with holiday travel underway. Does Omicron cause more serious illness? The variant is simply too new to know how those infected will respond over the long term. What has us concerned is that Omicron will result in an uptick of COVID cases, which were already creeping back up before the new variant was identified. In St. Louis County, we're averaging 255 new cases a day, and that's a 9.5% increase from the prior week. The positivity rate is now 8.4%. Our hospitals are keeping close watch as well. Medical experts worry that with increased indoor gatherings during the holidays, the number of cases will continue to increase. Each week passes, and more of our residents are getting vaccinated, and the parents have been getting their 5 to 11-year-olds vaccinated so they can stay in school and gather safely with family members during the holidays. However, the majority of our kids still have not gotten their shots. About 24% of our 5 to 11-year-olds have received at least one shot. That's not bad for the first month of eligibility, but that's still too many young people vulnerable to the disease, especially with the new variant circulating on our community. Looking at the overall population of St. Louis County, 56.2% of our residents are fully vaccinated, and 64.7% have had at least one dose. This is a slow but steady climb. Vaccines became this year's biggest science event. Unfortunately, this game changer in fighting the pandemic devolved into one of the biggest political debates in our country, along with masks. We know that both work to fight in this pandemic. And it was good to see a recent analysis by the Missouri Department of Health and Senior Services that determined in counties such as St. Louis County, where mask requirements are in place, the spread of the virus slowed, as did deaths related to the virus. And I appreciate the state's Department of Health and Senior Services writing to local health departments, applauding them for their unwavering work to protect the health and safety of all Missourians prior to and during the pandemic. The director of the Department of Health and Senior Services said in his letter November 30th, the continued commitment to duty by the public health workforce will undoubtedly allow us to prevail and prevent disease in the future. The effect of the public health workforce are success stories throughout the implementation measures, all made to ensure the public's safety in the face of both personal and professional sacrifices. You are truly heroes to your community because of the work that has saved lives. I agree. The clash between politics and public health continues, and misinformation jeopardizes the safety of our most vulnerable. I ask you to tune out the noise. Encourage your elected leaders to make the choices that will help us end this pandemic and continue your responsible actions. Let's hope that Omicron does not set us back, but let's also not discount its possible impact. Vaccines and masks, together they work. Thank you, and I'd be happy to take any questions.
Dr. Page, how serious do you think the Omicron variant could be, and are the concerns justified at this point about what the possibilities are of it hitting areas like that?
So the question is, how serious is the Omicron variant? And I would turn to our public health experts and our scientists to help us understand that until we have more data. And we don't have a lot of data because it's new. But it does appear to spread quickly, as it did in South Africa, and it appears to be moving quickly across the world. And we will take that seriously. It does have a great many mutations, more mutations than previous variants, and that's not a good sign. We still don't know yet how it will respond to the vaccines, but the initial evaluation by our scientific community is that the vaccine should be effective against the Omicron variant for any serious disease. But that's all we know today.
Could we see any restrictions change in the county? Could any of them be reinstated? I know that possibly mask mandates were being considered being lessened after the holidays. What's your take there?
Oh, so question about restrictions. We will we'll consider we'll continue our mask mandates because we've always known in St. Louis County, and it's been reaffirmed by other scientific studies and even our own Missouri State Department of Health that areas that have mask mandates do better. They have less cases and less deaths. So we'll continue with masks in St. Louis County as long as that's the advice of our public health experts, the pandemic task force, and our scientific community. As far as other restrictions, I don't think we're there. If we can keep masks on folks and continue to get folks vaccinated, we're at 64% now for a first dose, continue that pathway, then I think we'll get to the other side of this.
On the DHSS analysis, you've said multiple times that when you're asked in public that the mask mandate's not being enforced, people are not going to be punished for not complying. So why do you think it's effective, according to the DHSS analysis?
So the question is, how can a mask mandate be effective if we're not punishing people who don't comply? I think that a lot of people will do the right thing when they're told to do so, and that's why the mask mandate has been effective. And that's why in St. Louis County, we have less disease and less death than other places in the state that don't have a mask mandate in place. We don't always have to have confrontation to get a good result. And this is a great example of how people in the community, when advised what to do by our health department, will do the right thing.
There could be some people who read that analysis and make the inference that it's not the mask mandate that's causing the lower rates, but it's higher vaccination rates and perhaps more Democratic voters and Democratic people that would wear masks voluntarily compared to outstate Missouri, which has more Republicans who may not wear masks. But if you look at polling, that issue does fall around partisan lines. What would you say to that?
Question is, it's hard to summarize that. I think that's more of a statement than a question. So I guess I would acknowledge that there will always be arguments as to what's lowering the cases, and those arguments will always have political analysis, as your experience is in politics, and I respect your political analysis or your reflection of other political analysis. But our scientific community tells us that mask mandates help, and that more people wear masks in the presence of a mask mandate, and that we understand that a higher vaccination rate in St. Louis County will help some, but we believe the advice and the analysis by our scientific community that the mandate makes a difference. And as long as that mandate is in place, we think folks in St. Louis County will be better off until our scientific community and public health experts say that we don't need it anymore.
The county council is expected to vote on mask mandate tomorrow. Can you clarify what's at stake with that vote? What would happen if the council were to reject a new mandate?
Well, if the question is what happens if the council rejects the mask mandate? And first of all, we're still in a legal quagmire with Cole County Court ruling, and we'll follow that legal pathway to wherever it ends. It was certainly an unusual ruling that has gutted public health law in Missouri, all the way through to our ability to have isolation and quarantine for other public health infections, not just COVID, and some of the basic functions of public health in Missouri. And we hope that the courts will fix that. The friendly fire case between the Attorney General and the plaintiff has certainly created a challenge. There's another pathway to masks through an existing ordinance in St. Louis County, and that's a simple vote by the county council to support that. And if the county council votes to support a mask mandate, then we believe more people in St. Louis County will continue to wear masks. There will continue to be folks who don't, but we believe that more people will. And if more people are wearing masks, then St. Louis County will be better off. And we hope that the county council will continue our policy of masking in the county because it will save lives.
Are you due back in court this week for that mandate?
We do have a court date coming up in the next few days. I don't know if it's this week or early next week.
And what's ahead for that? How are you all planning for that?
Your question is how we're planning for the court date. Our lawyers are making those legal decisions, and they'll make our arguments.
I asked last week about the unusualness about the Attorney General not appealing, and Chuck Hatfield, who's a very smart attorney on Twitter, suggested that maybe like St. Louis County could intervene and seek an appeal that way. Have attorneys figured out whether that's possible yet, or are they still studying that possibility?
So the friendly fire case between the Attorney General and the plaintiff that has tangled this up with an unusual result and blocked pathways is extraordinary. It is unprecedented, and it has created quite a problem for people in Missouri. We have a lot of legal experts looking at our strategies, and we'll deploy whatever we can to try and do everything we can to protect the health and welfare of people in St. Louis County, because we know that our public health orders have saved lives in St. Louis County and have made a difference.
I have a question from back at the newsroom. They want to know what's the future of the health department after the full county council did not vote to approve Dr. Khan to the health director role permanently. Will you all be searching for someone else to lead the department long-term, or how long can someone serve as an interim director?
So the question is about our public health director, Dr. Khan. We have acting directors across county government, and from time to time we have acting directors in place, and acting directors can continue indefinitely. And I don't have any plans to change the leadership of the health department. I think Dr. Khan is doing a good job in a tough time in the history of our country and a tough time in the history of our county. Health department directors across the country are under attack, and I expect that to continue until we're on the other side of this pandemic.
You've had some council members who are critical of Khan state that because of their thoughts about his non-confirmation, that'll impact how they'll vote on a mask mandate. Do you see that as a risk?
Question is how council members might vote on masking based on their like or dislike of leaders in the community. I would be surprised if personalities drive decisions that save lives in St. Louis County. I don't think our council is wired like that. I think political observers might like to see those sort of things. But many times in leadership and many times in government, we have to work with people that aren't friends, work with people we don't like. But in the end, we have to do the work of people, and we have to make decisions on what's best to protect people. Making decisions based on personalities is not good leadership, and I don't expect to see that from this council.
I have a broader question about the confirmation process. If you can nominate someone to be an acting director and the council votes it down, but they can still be acting director, what exactly is the utility of the council voting on your nominees?
Well, the question is about a policy question or a politics question about confirmation. And government historically in America has been designed to not be shut down for political impasses over personalities or philosophical differences. And if you're not able to run a department because you have one branch of government who doesn't consent or approve of your leadership, then that department would shut down. And we see that at the federal level, we see that at the state level, and we see that in the local level across our country, is that you still have to be able to run. And that's why the charter allows for acting directors until full directors can be confirmed. But this happens from time to time. It's happened in the history of our country. It's a long-standing part of the history of our state and our local government. Confirming a department director provides some security, some statement of support, some statement of confidence. But in government, there are disagreements, and historically there always will be. And sometimes legislative branch doesn't have full confidence in somebody in a pandemic type situation when public health directors are under attack. It's not surprising that we have that situation around the health department.
So based on what you just said, like their vote is essentially a statement. It doesn't really have any functional impact. Is that what you're saying?
It doesn't change the way the departments function.
Yeah.
And that government is designed by that to prevent a shutdown. And that's why it's that way at the federal level, that's why it's that way at the state level, and that's why it's that way at the local level. And you don't need dysfunctional impasses to prevent government from working. That would not be good for our community.
Going back to the mask mandate, the state health director said that the Greene County court ruling would take effect, I think, December 22nd. Is that the case then, that if the council doesn't approve a mandate tomorrow, that after that December 22nd date, there won't be a mask mandate in the county?
You know, the question is about the Cole County Court ruling related to the mask mandate. And, you know, all of the legal implications of that haven't been sorted out. There's still a lot of things we don't understand. We still don't know about when it will be appealed. And everyone has an opinion. A lot of those opinions are filtered by what they would like to see happen, or they would argue for what they would like to see happen. And I would say that we're still not sure yet. And we'll know in a couple of weeks. A lot of it in St. Louis County will depend on where the council goes and whether or not they want folks in St. Louis County to wear masks.
I did have one more question. On
Okay,
a different
sure.
topic on, there's a bill to make elections in the county nonpartisan.
Mhm.
What are your thoughts on the bill? It could go for a final vote tomorrow. And what kind of conversations have you had?
Well, I don't support it. I believe that folks should know who they're voting for, especially in something as important as county government, where we have a lot to say about what happens in the lives of folks here in St. Louis County. And people need to know the basic philosophical compass of the person they're voting for. So I don't support it, no.
Do you think the dividing line in county government is Republican, Democrat, or whether the council supports the county executive or opposes the county executive? I would say, okay, this is a statement. I would say it's the second option based off history, but what do you think?
I think that anybody can make any assessment they want. It depends on the issue. And, you know, it'll be, I think over time, historically, county government has been relatively nonpartisan, but as our country has become more partisan over the past 5 years, we've seen more partisan division at the local level, and we'll see some of that. There certainly are some personalities involved, and that's fine. I mean, that happens in the state government as well, and you're familiar with that as a political reporter. You watch those things. I say everybody gets to make their observation, and I would say it depends on the issue.
Dr. Ray, do you think you have the votes on the council to pass a mandate tomorrow night? And if you do, does it hold any merit given the Cole County decision?
Well, the council, yes. First of all, question about the mask mandate tomorrow. It's not about me, first of all. It's not my vote. This is about the health and welfare of folks in St. Louis County. It's the recommendation of our public health department. It's a recommendation of the scientific community, and even our state health department has said that the masking policies of St. Louis County have saved lives. And if we want to continue saving lives in St. Louis County, then we should do everything we can to get people to wear masks. And a mask mandate will raise the masking compliance in St. Louis County. It's the right thing to do. It's not about me. So I would say that the council will do what's right for St. Louis County. And I would be surprised if they don't. They've made a lot of statements in the past, and they've voted to support masks in the past. And with COVID getting worse and with a new variant in our region, can't imagine that would go in a different direction.
Last question would be, would you ever consider a similar action like the New York city, their mayor imposing vaccine mandates on the private sector, not just city employees. Is that something you would ever consider here in the county?
The question about mask mandates, or a question about vaccine mandates by local government, we're not considering that. We don't have the authority to do that. That's not something that local government could do, or that's a federal issue. And we do have a mask, or we do have a vaccine or test mandate in county government, and we'll continue that for county employees. Yes?
One last question for me, again, switching to another topic, but the council last week expressed an interest in not taking much action on ARPA funds
Mhm.
until early this next year. How does that impact the budget plan?
Oh, the council, yes, the question about what the council's going to do with ARPA money, I think it's prudent to think through some of this stuff. We have 3 years to appropriate the funds. We have 5 years to spend it. There's no urgency. It's not like the CARES funding when we were in an emergency situation with a virus that we didn't know what was going to do to our community, with public health crisis and a humanitarian crisis. That was a different setting. I think it's prudent to be thoughtful about how to spend the ARPA money, spend some time listening to folks in the community. I still think they'll use it for some lost revenue in the budget, but they'll make that decision. The council has appropriation authority and can set the basic guidelines for the budget in St. Louis County, and I respect that, and we'll find a path forward.
Any other questions?
Okay, thank you.